The variant first discovered in the UK is now the most common strain circulating here in the United States. That's according to the CDC. The more contagious variant is fueling clusters of infections among children and young adults. Total infections in the U.S. are now at more than 30.9 million, and the death toll has topped 559,000. Health experts say the more people get vaccinated, the more those numbers will trend in the right direction. So far, more than 64 million people are now fully vaccinated. Meanwhile, Dr. Fauci says there is no precise number of vaccinations the U.S. must reach before fully reopening. Instead, he says, quote, "We'll know it when we see it." Nikki Battiste reports on the latest from New York City.
Tonight, the fourth surge driven by variants and attacking kids, with 44% of all new COVID cases found in just 5 states. The highest positivity rate, children 12 through 17. And that highly contagious UK variant, now the nation's dominant strain.
Across the country, we are hearing reports of clusters of cases associated with daycare centers and youth sports.
Public health experts say the variants are more transmissible among kids, who in the early days of the pandemic were not seen as high risk for infection or serious illness. In Europe, new concerns over the AstraZeneca vaccine, not yet approved in the U.S. Regulators in the UK recommending it not be given to anyone under 30. There's a rare link to blood clots in adults. The positives still outweigh the risks, with just 79 cases out of 20 million doses given.
Blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine.
Tonight, a disturbing study out of England concerning COVID survivors. It's estimated that more than 1/3 experience long-term brain issues. Neurological symptoms include anxiety and mood disorders, and in some patients, even dementia and strokes. There's also hope that one day a pill could replace the needle. An oral vaccine currently being developed and tested at a research institute near Los Angeles.
To have a vaccine that's room temperature that could be a pill is life-changing.
Even with the U.S. averaging 3 million doses a day, there are still roadblocks. Look at this line in Maryland. People without appointments waited hours to get a shot. The urgency now to protect kids and get them safely back to school. What students have missed over the course of the pandemic is boiled down to 3 words in the latest Time magazine: the lost year. 17-year-old Twyla Joseph is on the cover.
I didn't get to take my SATs and they kept getting canceled. Am I going to go to college? Am I going to have a job? Just sitting at home, like on your laptop, and then going back to sleep every day. It makes you depressed, it makes you feel lonely, and it makes you feel unmotivated.
1 in 4 adults in the U.S. is now fully vaccinated, and the White House said today half of adults could receive at least 1 dose by this weekend. Lana?
Nikki, thank you. For more now, let's bring in Dr. Len Horovitz. He's a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you for being here, and thank you for all that you do. So the CDC says that the variant first found in the UK is now the dominant strain that is here in the U.S. This is something that experts anticipated several weeks ago, and you and I have discussed. How much does this fact now change the fight against COVID?
We're still in a race with the virus against the vaccines, but the good news is that the vaccine is effective against this variant B.1.1.7. Even though it's spreading wildly, if we can get vaccinations to spread faster than we get infections, we'll be able to get ahead of this.
Well, the head of the CDC believes that vaccinations have led to a decrease in COVID deaths, but how long until we see a similar impact on infection rates?
I think that will take more vaccination. And of course, we can't ever forget the public health measures of masking, social distancing, hand washing, and of course, gatherings. These are super spreader events, gatherings and crowds. And so if we eschew those values, we will have more infections. If we can keep the infection rate down by public health measures and vaccinate at the same time, we can get ahead of this.
Well, last time the two of us spoke, we discussed the confusion about whether vaccinated people can still get infected and then transmit the virus to somebody else. But there is some new real-world data that's giving us some good news on asymptomatic transmission. What more can you tell us about that?
This real-world data has come out of Birmingham, England, Israel, and also the Mayo Clinic. You have to remember that in the studies, patients weren't swabbed who took part in the vaccination trials. But now the Mayo Clinic has been swabbing all incoming patients who are vaccinated, and healthcare workers in Birmingham and also in Israel have been studied, frontline workers who are vaccinated. All of those studies seem to indicate that asymptomatic transmission does not occur. The virus cannot replicate in the nasopharynx sufficiently to pass on to someone else. That said, of course, you have to remember a vaccine is not 100% effective. If it's 95% effective, there are still 5% of people that will get infected to the point of getting mildly ill, and they can, of course, transmit, but they're obviously sick people. So the good news is asymptomatic transmission in vaccinated people is really not happening.
That is really good news, and important to remember that that even how promising these numbers are in terms of how much they keep people from either contracting or the more serious forms of COVID-19, that it isn't 100%. One last question for you, Dr. Horovitz. A study published in the journal Lancet Psychiatry found a third of coronavirus suffered something that is a bit surprising that we didn't know about initially: long-term brain or psychiatric disorders. What do we know about the neurological effects of the virus? And are there certain patients that are more at risk of this complication than others?
Some autopsy studies have shown that the virus can penetrate the central nervous system, the frontal lobes, and other areas of the brain. So viral particles have been found in those areas. And when that happens, of course, that means that there will be brain damage or psychiatric changes, especially if those damaged parts are the frontal lobes. Then there's the whole psychological trauma of having gone through COVID, which is a difficult and sometimes disabling process for many patients who will never get back to normal.
Yeah, those are the things that researchers are still learning so much about. All right, Dr. Len Horovitz, thank you.
Thank you.